So we're going to be talking about hip labrum repair post-op. The number one thing that we see is usually people post-op, whether it's hip, ACL, different things like that, is that patients tend to come in maybe 2-3 weeks after surgery, maybe a month after the surgery has been done. A lot of times what happens is they're at home just relaxing. What we suggest is within the first week, try to come into the clinic so that we can spend the time actually explaining what the protocol is going to be, what the next 6 to 12 months looks like, and we can go through everything and start with day one. What we tend to see is people come in 3 weeks later, and then we're already kind of behind the ball. So what we suggest post-op is definitely come in as soon as possible when you're comfortable. And then we can start actually discussing what those details look like for the next 6 months. So at this point, we're in phase 1 post-op. So this is from day 1, you just had the surgery, to 3 weeks post-op. In this phase, what we're looking to do is protect the integrity of the labrum as much as possible. We're trying to do a lot of internal rotation of the hip and a lot less external rotation because the outside of the hip just had surgery. So we're protecting it as much as possible. We're looking to do some flexion in the hip, but nothing more than 90 degrees at this point. And then we're trying to normalize gait pattern within this range. So within that 3 weeks, we'd like to see you off of the crutches and walking normally by the end of the 3 weeks. At this point, we have to protect the labrum as much as possible. We're just trying to get exercises to help with swelling at this point post-op. So very basic exercises. So he's going to drive his toes up towards his head and then slowly drive his heel down. And then we're going to slide up to about 90 degrees and then slide back out. Just heel slides coming up, and then as he progresses and gets better, he can progress his range of motion as long as there's no pain within the hip. A second exercise that we tend to give, this is a multitude of individuality in this, so these are just specific exercises that we're giving for this individual. It all depends on the individual and the labrum and how it was repaired and all these different contexts. But a second exercise that we give in week 1 is quad sets. So he is going to just isometrically contract his quad by extending his knee. So let's do that right here. And he's going to hold for about a 3 to 5 second hold and then relax. And then he's going to isometrically control, again, isometrically contract, go. What we're looking to see is that there's no pain in the hip and he's not shifting to get the quad contraction, that he's just remaining stable in the hip and being able to contract his quad. Okay, so we are in week 3 now of phase 1. We are trying to get more activation, more extension in the hip, a little bit more muscular activation. There should be less swelling in the hip at this point. Gait should be regained in terms of functionality. So we are doing a banded glute bridge. So we are going to say toes up to the sky. He's going to drive through his heels, squeeze his glutes as he comes up and keeps the band from coming together. And come down. What we want to see is him getting full extension of the hip. We don't want to see compensation from one side to the other side. So come on up. You may feel stiffness and pulling, and that's fine. That's discomfort. We're not looking for irritation. So as he comes up, we don't want to see the knee cave in. We don't want to see both coming in, and we don't want to see compensating through the non-surgical leg. So we're in phase 2 at this point of the surgical repair for the hip labrum. About weeks 4 through 6, if we pass the criteria to get here. Now we're going to start using our force plates. I want to just do a quiet stand test. So we're trying to see, is there any shifting based on the load on the surgical side versus non-surgical side. And one of our things that we're going to add as an exercise is just mini squats. So just body weight squats, range of motion. And so to be able to do that, we're going to use the force plates and do a squat assessment to see how much shift is occurring when he's squatting. Is he loading more on the left surgical leg or is he loading more on the right, depending on where the surgery was. What this will allow us to do is see compensations within the squatting at this point. Is he shifting more away from the surgical leg? How much load is he putting through the surgical leg? And allowing us to actually have the raw data to see where our rehab is headed. In phase 2, our main goals are just to normalize gait, regain range of motion, full range of motion at this point. We're clear to kind of push the limits in our range of motion here. So we're going to do a lateral step up. By now, the patient really hasn't done much laterally. So we're just trying to gain that range of motion back. So as he comes up and comes together and comes back down, what we're looking for is not hiking of the hip as he's doing this, but his ability to flex the hip, come up comfortably and come down comfortably. So this would be the surgical leg in this point. As he comes up, we're looking for any swaying and compensation of the upper body, left or right. And this would be an at-home exercise that we would send the patient home with. Start off with a smaller box and work our way up to a higher box. So the transition between phase 2 and phase 3, which is about week 4 to week 8, 9, what we suggest is a lot of patients have access to potentially a pool. They can get into aqua aerobics, they can get into flutter kicks, different things like that can challenge the hip with reducing the load of the weight by being in the water. So that would be one thing that we send the patient home with. If they have access to it, great. If they don't, it's not the end of the world. We send a bunch of different progressive exercises, but that's where we would start to implement some pool work as well. As we enter phase 3, we're trying to do progressive strengthening at this point. We're trying to gain more range of motion, more strength, but we're able to get into more dynamic exercise at this point. So we worked laterally unweighted. Now we're going to work laterally weighted. We're going to start with a basic band. He's going to bend his knees and he's going to go for a lateral monster walk to the left. So he's able to load to the left, and then we would go back right and make sure again that he's not just pushing through his right hip, and that the left one is able to withstand the resistance of the band as he comes back. Going phase 3 and 4, we're going to start adding more loaded exercises at this point. So going into a lunge, we're going to start just stationary. So go nice and low, as deep as you can. Good, and back up. And we're looking again for even distribution of weight. We're not looking for compensation. We're not looking for shifting to the left or shifting to the right. You can start with just a 90-degree bend in the front knee, going as deep as possible. That's comfortable. At this point, again, we may feel a little bit of pulling and some resistance in the hip, but there shouldn't be any pain or any swelling or anything like that. The transition from this is then, as the weeks go on, we can get him to transition into a walking lunge. So we'll get you to walk lunge towards the sled here. That's the exact transition we're looking for at the beginning, is to step up together. Do one more here. And then as you step back, just transition, swing through without stopping in between. So turn around, face me. Good, so transition through, perfect. So as we're progressing through these phases, we get to about the week 12. Week 12, we have a test that we'll do. So it'll involve making sure that the girth of both quads are the same. We can do strength testing as well at that point, seeing what the difference is between strength testing on the left and the right. And then we would also use our force plates as we're going along these phases to make sure that we're seeing progression in load. So it's normal to see more push on the non-surgical leg as you start with the squatting. What we're looking to see as we're progressing is that it's evening out to 50-50 and not having asymmetries. We'd like to see our asymmetry at least below 15% at this point. So now we're in phase 4, headed to phase 5, kind of return to play. He's passed all of our testing at this point. We're looking at more plyometric exercises. We've done a lot of force plate testing to clear these exercises. So like a land and hold test to make sure that he's able to withstand that and the asymmetry isn't more than 15% at this point. So we're gonna start with depth drops. He's just gonna go into about 3 reps here. Perfect, he'll step back up. And again, we're looking for any compensation. Does the knee collapse? Is he able to land and withstand the load? Is there any pain in the actual hip? Good. And then a progression from here is we want to be able to see, can he step laterally and land on that surgical leg comfortably? So he'll come down into a depth drop, and then we'll load to the left and then hold. He'll come down and then load to the left and hold. Good. So these are examples of some progressive plyos that we'll get into after we have cleared everything with the force plate testing. And this is kind of, we're getting close to return to play at this point. So we do a couple weeks here and then we retest again, and then we can progress into different plyometrics before he ends up being returned to sport ready. After about 4.5 months, 5 months of rehab, we're kind of at our return to sport protocol at this point. So this is an example of him doing bilateral pogos. He'll transition into a single leg pogo on his surgical leg. Good. What we're looking for is making sure that he can bounce off the ground at the same pace of the surgical leg as the non-surgical leg, that he can withstand the load going laterally, going forward, going backwards. And really what we're looking for is just his ability to have his return to sport. So it depends on his sport. So for him, it would be football. There's a lot more testing than just this that we would do. But our force plate data is what we're using specifically to be able to tell us when he's prepared to return to practice, return to sport at that point. And then there's a couple of weeks and a couple of months where he'll return to his sport, and that's more on the coaching side, is his ability. Can he actually perform in the football sport itself versus being able to perform on force plates is a little different at that point.